Welcome to Athletic Women Thriving in Perimenopause and Beyond. My name is Tenille Hoogland, and I am the host of this incredible series and have the opportunity to talk to incredible people in mindset, nutrition, training, recovery. And today we have Denise Schwartz. Welcome, Denise. I'm so glad that you said yes and you're joining us with your expertise.
Well, thank you for having me, Tenille. I'm very excited.
Yeah, well, let me tell everybody who's listening a little bit about you and why it is that I was just like, oh my goodness, truth be told, is when we first met, I just wanted to go, like I wanted the interview the next day, because some of the things that you're bringing forward are just really unique and special to what we want to bring forth. So you are the owner and founder of the Manual Touch Physical Therapy. And you've been doing this, like you've had 30 years of experience. And what is really interesting about how you do this is that you're very much holistic. You look at the whole body approach to health. And we're going to talk a little bit about this in terms of like how you first take in a client and understanding the client's whole history of their body and understanding how that will impact some of the challenges that they have. You have extensive training in manual therapy, in spinal care, functional rehabilitation, and you really are working with people that have suffered from chronic pain, spinal conditions, running and triathlon injuries. It's just like, I don't know if some of those are crossing over, balance and vestibular disorders, which is really interesting for our population here, and various non-traditional and traditional manual therapy. So you're bringing it all together in a holistic piece. And basically what you really are committed to is helping people reduce pain and improve their quality of life.
Exactly.
And so if you're ready, and is there anything I'm missing? But I really want to just dive into what we want to talk about today.
I think probably just a teeny bit of a history. I've been a physical therapist for a really long time, over 30 years. And I started my career out of school working in a hospital. So I had that inpatient medical background as well. And then within a couple of years, concentrated on outpatient, which would be typically, people come to see me with a pain or injury or whatnot. Along the way, I became an expert in treating back pain. And then I started studying a non-traditional form of manual therapy, really looking at the whole body and finding out what is preventing somebody from healing. I then left the hospital I was working at to work for this company called Center for Integrative Manual Therapy, where we saw a lot of complex and complicated medical conditions, and people just didn't get better elsewhere. What I found was this approach was what we call an indirect approach. So we're working with the body instead of fighting it and forcing it to do. We might have all come out of school going, oh, I'm going to fix this problem and find it. But that doesn't work for everybody. A lot of times people's bodies rebel against real forceful direct techniques. Some people respond to it well, but others don't. At any rate, I found I had a very good knack for this non-traditional work. I worked with them for about 7 years, and then I opened up my own practice in 2010, the Manual Touch Physical Therapy here in Wheeling, Illinois. And I developed a passion for running. So I became an expert in treating runners, and my son's a triathlete, so I treat triathletes as well.
It all
That's kind of how I got here.
Yeah, it comes back to home. Well, no, I really appreciate that, and I think that, and what I want to encourage you and ask you in the interview too is understand that maybe we don't always know when we are in and up against force as opposed to working in flow with our body. Sometimes when we prescribe, like if we go to a more or a traditional way of treatment, what does that actually look like as opposed to coming and working in alignment with, and so I think that'll come out, but I want to hear that. I want to kind of bring in some of that real true understanding so we can start to even recognize it, going, oh, this is me working something I need to work, like activating my glutes or doing something, as opposed to seeing like maybe something, there's another way to support the body. let's get into just situating ourselves in this time. So we're leading up into perimenopause, we're in perimenopause, or we're in the beyond. And what are some of the major things that you're seeing, just in a more general sense, of physical changes of the body that are maybe we need to be aware of from a holistic standpoint?
Well, so we know scientifically our bodies go through change as we get into perimenopause, as we get older. How you, as an athlete or an everyday person, will notice those changes is that all of a sudden you might not feel as strong as you used to be. You might not be as flexible. You might not be as fast. You might not be able to do things exactly the way you used to do it 10 years ago. And that comes up with a lot of frustration for women and all people. And what's really happening is you can't fight nature here. This is just the way it goes. As our hormonal changes are happening in perimenopause, we are going to get an increase in body fat. And along with that, you get a decrease in muscle mass, bone mass. And when you have that, you lose some strength. Your tendons become less flexible. They become a little bit more rigid. And through all that, your joints don't move as well. So what's the functional outcome of that? Is you have some decrease in balance, decrease in speed. Your reflexes aren't as good. It's harder to recover from things. You need a little bit more rest. So there's a lot going on. And I know it can be very frustrating. However, if we could accept some of this with some grace, we can work with this and not fight it.
Right, right. There's a lot of work that we can do to support our bodies to not, like, we're going to age, like, as you said, it's inevitable.
We're gonna age.
Exactly. Every minute, actually. But there's a good story here because of all the things that we can do, and that's how you're supporting. Okay, so we understand now the kind of the situation you're coming in. So now when people come to see you, there's a challenge. They may come in with injury. They may actually have chronic pain. How is it that what is it that you believe in terms of taking in this full medical history and looking at it a holistic view? And what is it within the body you're noticing or trying to identify?
Well, when someone comes in to see me, I really want to know everything medically that may be going on with them, or in their past, any injuries they might have had. I can't tell you the number of times I've had people come in and it was due to an injury they had as a child, because let's say you fell down the stairs, or gosh, I had a couple. What was this? This one woman, she realized she had this severe pelvic pain, and we realized when she was 10 years old, she was playing a game, and I don't know, was jumping over a baton or some stick or whatever and landed on it. It was just so traumatic. So I think there was a connection there at any rate. So it's really important to know these things. People have had surgeries. So I want to know where those surgeries are, where that scar tissue is. It's very important because that can play a role in what's going on with their current injury, or their current limitations, or what they can't do, or what they can't do anymore. So it's very important to look at all those pieces.
Right. And one of the things that you really highlight on, and what I am quite fascinated about is scar tissue a little bit more. Can you talk to us a little bit about how scar tissue works? Like, can you ever, when something has happened, traumatic has happened in the body, can you just talk about what is actually happening to that tissue and what scarring actually even means? Like, we have this idea, but I want to really clarify what that actually looks like or feels like. And can we ever get rid of it? And yeah, some of your thoughts on that.
Well, scar tissue forms, we know we have scars when we have surgery. A surgeon cuts in, and then he or she has to sew it back up, and you get a scar. There's nothing you can do about it. Sometimes just falling, and let's say you fell on your knee on a rock or something, and maybe you get a bad cut. If that's the scar forms. And what's happening is your tissue is healing to bring those tissues back together. All right. So scar tissue is a healing mechanism um, that allows the tissues to reconnect. Okay. What happens is it becomes over time, it can become kind of insidious. That scar tissue kind of keeps forming over time, and it kind of can create little tentacles. So let's say you get your an abdominal scar, whether it was a C-section scar, which is often a bikini scar. But I do ask women, was it a bikini scar, or did they actually have to go in and do vertically? You know, so women, older women, I mean, I don't remember when they stopped doing vertical, but you know, long time ago they used to do a vertical scar. And then sometimes I had someone just recently, it was an emergency that they had to do the C-section. They wound up doing a vertical scar over the uterus, but on the outside was a bikini scar. So, you know, you get internal scars and external scars. And those scars, and in the form of healing, the fascial tissue around all your organs and muscles are all trying to heal this area, right? And so sometimes tissues and organs and muscles start glomming together, and so they're not very fluid anymore. So we have to, that scar tissue can penetrate and attach to other organs, causing restrictions. So I had this woman, I know we're really talking more about perimenopause, but a woman who was pregnant, an older woman in her late 30s, she had a C-section and she had multiple other gynae procedures done. At any rate, she developed severe pelvic pain, which isn't uncommon when you're growing and you're pregnant. And it's usually a simple treatment to help kind of align the pelvis, because it's expanding to make room for that baby, and sometimes it gets shifted. At any rate, what I found was the scar tissue from that C-section and the multiple other procedures she had through that scar, and adhered to her pubic bone. And so as she grew, the scar didn't allow her belly to expand the way it needed to, so she developed a lot of pain. So throughout the rest of her pregnancy, I did a lot of soft tissue work on that scar to get it more mobile, get it softer, allow the tissue to expand and move, so then she could get through her pregnancy pain-free and have a healthy baby. So
it's fascinating. I think another thing that you said that was just like, okay, so this idea of scarring, it can start in one place and it can actually, you mentioned tentacles, like
yeah,
how it can kind of spread out in its way to try to, why is the body doing that? Or how is it that that's supportive?
I'm not so sure I can confirm that really happens. That's what it feels like is happening. But yeah, but I think what's happening is the all the fascial layer of tissue. So fascia is a very thin layer of tissue surrounding all of our organs and muscles. And I think what's happening is it just, that starts, in order for the body to heal from that injury, the scarring, you know, let's say the surgery, the scarring, that starts adhering together to kind of make it whole again. And it just keeps going down layer by layer. So I'll get women who may have had, and I can't remember the official term for having your tubes tied, but you know, they'll go through the belly button. And I had a woman in her 70s, and she had a very big curve in her back. You know, we have a normal curve, but it was really excessive, because that scarring in the belly button felt like when I got on there, I could like touch her spine from her abdomen. It was so deep, and it was pulling that spine forward. So I think it's really just your body trying to heal itself, and it kind of gets a little overzealous. So it feels like little tentacles, and we have to kind of release all that and get things moving.
Yeah. Can the fascia, so when we think about this kind, can you actually, does it want to just kind of keep on returning to the form in which it's being held? And so it's on is it something that needs to be continuously supported? And I would suspect that movement is one of the ways that we can keep it pliable. Like movement is life, like in so many ways.
Exactly.
But is this, like, when I think about sometimes, like if that fascia is getting interwoven and now all of a sudden you're talking a lot about your organs, which I'm fascinated with, and understanding how those can kind of get twisted and turned and to try to get those back in alignment. And there's going to be, I've had visceral massage work done, and it is weird and it is powerful. And
Yes,
it is phenomenal work.
Yeah, you are correct, Tenille. It can be very powerful work. It can be very invasive work. It can be very, I don't want to say traumatic, but things get stored in our body, and so sometimes things surface. So I think I want to backtrack a little bit. So when, let's say you have surgery, and that scar is there, and there's stitches there for a reason to heal. So we can't touch that scar right away.
No.
The body needs to heal. And it takes a good 6 to 8 weeks for that scar tissue to lay down and everything get back put together and do how it functions. With that being said, there are things we can do working around the scar. Once it's fully healed, again, let's say from surgery or a terrible wound or whatever, we can then start working on the scar gently. And then over time, within 2 to 3 months after the injury or the scar and everything's healed, we can get there and be a little bit more aggressive, which is more of a direct technique, which I was talking about earlier. And this is where we do have to be a little bit more direct to get things kind of moving.
Okay.
And yes, you asked another question about, do we have to stay on top of this? And yes, you do. That scar never goes away. Okay. Once you have it, you have it. So the best care is to stay on top of it, so what I will teach people how to do some soft tissue work, self massage to kind of keep that tissue mobile. Plus we do other mobility exercises, and I like to do dynamic mobility. I don't do static stretching. I call them dynamic mobility, which would be dynamic stretching. And that kind of eases the body in. That's kind of an indirect approach. Let's work with what you have. Maybe we only move a small range because this is all your body wants to do right now. I can't tell you how many people come in and they go to yoga, let's say, and they're having pain, whatever their injury is, I don't remember, let's say. And they may be very hyperflexible or hypermobile, which is very common with a lot of women. They don't really quite realize. They think it's good, but that hypermobility sets you up for other issues. So at any rate, if they're taking a yoga class, I tell people I dial it way back. Like, okay, let's make this really small. Let's work in a safe distance. Let's work with your body instead of forcing it to move and keep up with the person next to you or the instructor. Let's do what you can do.
I think it's a really interesting point to make about what is good for our body when we think about mobility. What is good for our body when we think about stability? What, like bringing in these components of control and neuromuscular control. And can you speak a little bit more to that and understanding some of that? Because you're right. It's like, oh, can I bend over? Like, how far can I bend over? Can I get my, feet behind my head? Like, I don't know. I can't do that, obviously. I was a synchronized swimmer. I could used to do crazy, stupid things, which may have created a couple of problems in my current situation. But in any case, how is it that we can start to understand these things of what does flow mean as opposed to that force? I think that's coming back to where I started. And how can we start to understand where range of motion is healthy and then that's going beyond a range of motion that actually can have that neuromuscular control?
It's hard to figure out on yourself. I think it's, I'm no longer a runner. I stopped running a few years ago because of some of my issues. But I was known as an injury-prone runner. And so every time I got injured, I would go to see my physical therapist, who would find, okay, what wasn't moving, what's not strong enough, what's not working together, which is what we call neuromuscular control. That's the definition of that, is getting your nervous system and your muscular system working together and getting the whole body working together. So it is difficult to figure out on your own. With that being said, making something smaller is better than forcing yourself to push really hard through a flexibility range. I get some people, one of my friends is very flexible, and she has a dog. Lots of people with dogs, this can be an issue. You're bending over a lot. And it was very easy for her to bend over, but over time that was just too much. I'm like, you're just not strong enough. You're not using your core well enough to bend over like that all the time. So it's about getting the education and how to move appropriately for you and what you need to do to function throughout the day.
Huh. And so what would be the result of not, so how can we, so for example, we notice that, I don't know, in the case of this friend that was bending over to pick, I mean, it's such a perfect example, pick up her dog all the time. What
Yeah.
sort of things cued her into saying, hey, Denise, I've got this thing going on, and you recognizing, was it back pain, or is the chronic pain? And then how do we kind of go, oh, there's something that's happening, and then you kind of were able to connect the piece of dog bending over, mobility here, not using your core, potentially scar tissue. Like,
yeah. Yeah, in her case, it was back pain. She had developed some back pain, and through listening to her history and what she does, she has kind of an active job where she lifts a lot, and plus she's got the dog, and we love our dogs, but we do have to bend over a lot. We have to squat a lot. To take care of them. And because she was always flexible, she just kept moving and whatever. At any rate, she eventually got injured. And so the first point is to learn how to stabilize. So if you have back pain, let's say, even if you're super flexible, can bend over and touch the ground, when you're in that injured state, we don't want to do that. We want to let the spine heal. So you got to learn how to stabilize the spine, use your core, your abdominals to stabilize. Eventually, as everything heals up and you can lift appropriately with a good neutral spine, with good control, then we're going to learn how to move in and out of that range using your spine with their flexibility. But we got to get stronger and learn how to use the muscles around it to stabilize in that mobility pattern.
And some of that is obviously what you were mentioning, neuromuscular control, creating the synergy between the nervous system and the muscular system.
Correct.
And sometimes, and you also mentioned earlier, sometimes it's hard to notice it on yourself. So I would imagine when you are working in a manual touch sort of way, then you're helping them identify and saying, do you feel this? Do you notice this? Is this what's occurring for you?
Exactly.
Amazing.
That's what we do. Yeah.
Okay.
So when someone comes in, part of our our evaluation is we watch them move. We have them go through certain movements. We check strength, mobility. I watch them walk, and then I'm going to ask them, what hurts you? Is it sitting, standing, walking, bending over, whatever it is? And somebody might say, let's say it's a shoulder. Well, it hurts when I reach all the way back here or something. Other than don't do that, we need to learn how to reach those spots in a safe way.
Right. One of the things I'm curious about, when we hear about, okay, well, I have a pain in my lower back, and it's never about the lower back. Like, it's always something else. And I'm just wondering if you could speak to that. Like, there's a whole chain of actions and reactions and things that are happening within our body. And I'm wondering, just from your perspective, how you speak to that. Like, I have a knee pain. Well, it's actually, okay, yeah, your knee is the symptom of what's occurring somewhere else down the line. And can you speak a little bit to that, and how, again, I want you to tie into that scar tissue issue of like, and the history, and maybe you can pull us all the way through to seeing, all right, we have this problem, but it's not the problem you thought.
Right. Well, you're exactly correct. When you go in to see the doctor, and you go in, let's say, with back pain, they need to have a diagnosis. I mean, that's the medical model. The diagnosis, they might do a picture of some kind, X-ray or MRI, and they'll see something. Let's say they see a herniated disc. Okay, so you have that as a diagnosis, but why did you get there? So that's when they come to see a physical therapist like me, and I watch them walk and move, and I look at how they use their body from their feet all the way up. And we're trained to know what is happening at every joint, at every point in that gait cycle. One simple piece that I often explain to people is when we walk and our foot hits the ground. Let me see. I'll get my hand up here. So let's say your heel hits the ground here, and then it rolls down, and you roll over your big toe.
Yeah.
That is what's supposed to happen. A lot of people, maybe walk on the outside of their foot, or they fall on the inside. And as a result, they're not getting the movement in their ankle joint, which is called the subtalar joint, that they're supposed to. So somewhere up the chain, your knee, your hip, your back needs to make up for that loss down below. There's a very strong correlation between what's going on at the ankle and what's going on in the low back, particularly what we call L5S1, which is the lowest segment of the lumbar spine at the top of the sacrum. So oftentimes that's really what's causing the pain, is because something down in the ankle wasn't moving so well. So I had a woman come in, let's see, the Chicago Marathon was Sunday. So she came in a week before or whatever. And she was starting to develop some shin pain. And, my first thought was, oh, she's getting some shin splints. But it didn't really correlate with what she was saying. And as I poked around and I watched her move, she was tight up in her hips a little bit. So she was getting some stress and strain and overusing the outside muscle of her calf or shin, because her hips weren't shifting over. And I think it was also her ankles didn't have enough movement. So I gave her some mobility exercises that would be safe to do the week before the marathon. You don't want to change a whole lot. But these would be normal warm-up exercise to tell her body, oh, my ankles need to do this, my hips need to do that, and then my back can do what it's supposed to do. So it's very important to look at all those segments.
Yeah.
So sometimes that diagnosis or that picture on the MRI, it matters, but it doesn't matter. It's really what has led to it and what's still contributing to it and aggravating it.
I think this is what's so exciting about what is happening within the health field, is that you have people like the listeners of this, summit going, I want to know more. Like, don't give me, and I mean, it's like the pill, right? Like, it's like, I'm not going to be okay with just taking the prescription and hoping that it's going to go away because I've just masked something. We want to know. And so I think this is such a valuable, what you're talking to. So you've mentioned the value of the feet. One of the things I just want to just poke there before we get into stuff. I want to get into some of the running form matters because you have such incredible expertise there. But let's just touch a little bit. I know that big toe, man, that big toe is important. You're mentioning the ankle. Anything else that you wanted to point and make sure that the listeners wanted to know about the feet and how much we love the feet? We got to give you those feet some love.
So particularly about the feet. Okay. Big toe is very important. And that's actually why I had to stop running. Both my big toes had arthritis in it, and I had to have some surgery. Just happens. I think getting the right shoes are very important. I think it's important to go get fitted at a reputable running store to get the right shoe for you. And I'm not married to any brand. It's what works best for you. A lot of the listeners are athletes. We know that the shoes really come into three areas. There's a stability shoe, a neutral shoe, or motion control. Most athletic people, women, aren't using a motion control. That's usually for someone older who's got some really severe instability in their ankles. We're not going to go there. The stability shoe is for someone who tends to pronate too much, and really what it is a lack of control for the pronation. So pronation is those people who have like flat feet and the foot falls in too much.
Yeah.
And women, I think this brings up a really good point. Okay. Women, our hips are wider than men. And as a result, there's an angle that goes from our hips to our knees that's called a Q angle. And so when we squat, if we're not really good about using our hip muscles, our knees cave in, right? And then our ankles fall in. So that's that pronation component. So then the question is the chicken or the egg? Did you have a weakness in your feet, or did you have a weakness in your hips? Usually it's a combination of both. So as we're going through a rehab process or re-educating your body to work, we want to get you the right shoes to support you through that process as your body is learning how to function as optimally as possible. The other kind of shoe is a neutral shoe, which is for someone who's an underpronator, or somebody who has higher arches and don't fall in. They may be on the outside of the foot a little bit more. So you're really bringing the ground up to your foot. And some people need custom orthotics. Some people need over-the-counter orthotics. Some people don't need either. Everybody is different. When I see people and I think they need an orthotic, I usually like to work with them for a good 6 to 8 weeks to start really re-educating their body and see what we can make it do. You know, where can we get their better mobility? Where can we get their strength? Where can we get their stability? Because 8 weeks after doing exercises, their feet needs may change. So then if it's still needed, then I might send them on to someone to get an orthotic made.
That's fascinating. So really seeing if you can develop the strength in the system, the chain of command to get things going before we actually become, because being an orthotic wearer, I know how long I've worn my orthotics, and I probably could go back and start thinking, and you know, can I do work there? Is there something, you know, that I can actually consider? Have I done all that I can? And I'm pretty certain I haven't. You know, like human after all, and because it might be something that comes down the line that I don't know about. It's this holistic health again.
Exactly. Okay. So,
Okay.
you know, the goal isn't necessarily to get rid of an orthotic. You know, some people have, I needed to start wearing custom orthotics in my 30s. My feet got really tired. I have very high, rigid arches. And based on some of the measurements we take in the feet, I don't really want to get into that so much. There was an intrinsic, I was born with some foot dysfunction. So I needed custom orthotics.
Yeah.
Okay. And now since I had the toe surgery, I needed a different kind of orthotic to accommodate for the new toe position. So that's never the goal, is to get rid of orthotics. However, we do want to strengthen your feet. We want to strengthen your body. We want it working together.
Perfect.
And so as you get stronger, you may need a new orthotic. And for some people, it depends on what was going on. They may or may not be able to get rid of it, but that's, you know,
it's not
I don't think that's necessarily a goal. I wanted to say one last thing about the big toe, because you asked me. We know that when we roll over a big toe when we walk, when we apply pressure through our big toe, it actually will help activate your deep core, pelvic floor, and your glute muscles. So it's very important to be able to roll over that big toe. So if you've got bunions, hammer toes, or you injured yourself somewhere and you're not rolling over that big toe, then you're not accessing your core like you need to, and you'll start developing compensation. And at some point, you're going to get an injury somewhere down the line. So very important. Big toe is very important.
Oh my goodness. I'm so excited that you just shared that with the world, because that is not, I mean, I hadn't had that direct connection before made, and I just get so excited when I learn something so beautifully clear like that.
Thank you.
Amazing. All right. We are going to get into some running form. And so if anybody's listening, this is where you may want to come into watching, because Denise is going to bring us some slides and to help us understand this, and to also connect this to something called the OOV, and just to kind of show us a tool that might be useful for you. So she's going to share the screen when we're ready.
Okay.
All right.
There we go. All right, we're good?
Yeah, we're good.
All right. So We talked about these age-related changes. I think I wanted to put this in here just as a reminder for women, especially because this is our audience. I talked about how we have wider hips. And as a result, actually, it's very hard. Women, our lateral hip muscles, the outside and the outside of the hips tend to be weaker. And so it's very, very important to always be doing hip exercises. And I have a lot of tips on my website to give you some clues on some ideas for that.
Okay.
And then we talked about how things change over time. I also mentioned a story of a 70-plus-year-old woman who had a scar after childbirth and had problems now in her 70s. And so this all can be a problem later on. So we need to look at that. It's something we didn't talk on is about a diastasis where the rectus abdominis muscle can split during pregnancy. We're not going to talk a whole lot about that today, but it's very important that if you go in for an evaluation to someone, that they look to see if you have one, because quite often I'll see it years after you've given birth, and it's still a problem. Okay. So this is a wonderful tool that I discovered a few years ago through a friend of mine. It is called the OOV. And this has been what I felt was like when I went to the class, like the missing link to really teach our body really good neuromuscular control. It works your body three-dimensionally, so you cannot compensate. And it teaches your body unconscious competence. I think I'm saying that right. That's the way the creator calls it. And what that means is your core will be working unconsciously as you move. And this is what we want to strive for. So when you come in for physical therapy, we're re-educating your body to work as optimally as possible. And this core needs to be working all the time. So some of the ways we can use this tool, you lay on your back. Here's an older gentleman. I have it behind his back, which helps the posture. Here's, again, an older gentleman for balance. And here's my son, the triathlete, doing a more advanced. You can see he's on one leg and he's pulling down the band here. Okay. So I find it just to be the most wonderful tool to re-educate the body, to get that big toe pushing down, get that foot connected to the core. He'll do pistol squats on here on one leg. You can't compensate, any kind of squatting. So it's a wonderful tool.
Yeah, it's really interesting because it's challenging balance. It's challenging some coordination. It's got a lot going on in there.
Exactly. So anyway, I don't know where everybody's, I know we have a wide audience, look around for an OOV practitioner. I think it's a wonderful, wonderful tool. A lot of Pilates instructors use it. A lot of PTs are using it. You want to make sure you get, I recommend you actually work with someone before you purchase one. But if you did, it's only sold through one. The official OOV is sold through Balanced Body on Amazon through Balanced Body. You don't want to get any of the imitation ones.
Okay. Really helpful to know. Okay.
All right. I don't know. Do you want me to start talking?
I want you to keep going. Yes.
All right. So running. All right. So when a runner comes into me, we want to videotape. We want to analyze the running. And this is why. So here's my son about 10 years ago finishing the Chicago Triathlon. Could you see anything? You just can't. Somebody, he's just running really fast at the end.
Yeah.
I think he was 17 or 18 there, and he was really good back then. I think he may have taken 6th place or something. But anyway, so we need to videotape the run because you need to slow it down in order to really see what's going on. And we take it from different angles, from the side, the back, the front. Okay. So when we slow it down, we can see how, he's really what we call a gazelle. Okay. He's got these long strides. He's got that huge hip extension back here. And he really stands up tall and looks straight ahead. Which brings me to what I loved. And I learned this term. There was some triathlon coach years ago who posted a video describing two forms of running, two types of runners, gazelles and gliders.
Mm-hmm.
All right. So my son is a gazelle. All right. So, you can see he's got really, like, he takes off one foot, and I don't know how far that is, but it's a pretty far step, right?
Yeah.
And then you have me as a glider. Okay. And we don't look anything alike. However, there's nothing wrong with either of our forms.
Right.
Okay. We're both have pretty good posture. I have some hip extension. I'm looking straight ahead. I have a good drive elbow back. But the difference is, you can see here, he's got a way longer float time
Mm-hmm.
than a glider. And most people, as they get older, become gliders. You know what? I didn't research to see if any of, like, our professional runners, like from 50 years ago, who were obviously gazelles, what they are now at 70. But I think most of the time, everybody becomes a glider at some point.
Right.
I don't think I ever started out as a gazelle. And you know what? There's nothing wrong with that.
No.
There is some study showing that it may actually conserve some energy for us as we get a little older.
Mm-hmm.
But we really just want basic form. You want to be standing tall. You want to look straight ahead. You want to have good elbow drive back. You want to have hip extension. You want to land with your foot close to your body, not way out in front. It's a little hard in this picture, but you can see when he lands here, probably about here, he'll be right over his foot. And the same thing with me.
Yeah.
And the way we control a stride length is typically through cadence. There was a lot of talk, what was it, maybe 10 plus years ago, about the barefoot running and landing on your forefoot. Well, studies really show that most people wind up becoming heel strikers because you're fatigued. Number two, there's nothing wrong with heel striking. What you don't want is to overstride.
Mm-hmm.
So if we look back at Drew's running, his stride is mostly behind him.
Mm-hmm.
Oh, well, every time I try to pause during these videos is a problem. But anyway, yeah. So it's really back here, and then as he goes forward and he lands,
Yeah,
you can see he's landing
there.
right. Yeah, I got lucky that time. I landed right
perfectly.
Okay.
Yeah.
So he was a heel striker. This is at the end of a race. He's sprinting. He's doing sub 6 minute mile. And he's still heel striking. It's just fine.
Yeah.
Okay. Now, all right. The other thing we want is a good ankle lean. All right. So there he is, a little bit older. You can see he looks a little bit more buff. He's in college.
Mm-hmm.
So something I talked about with the form, you want to look straight ahead, drive your elbows back, make sure your knees stay straight ahead. And this is one of the easiest things, and almost always I have to correct with people when they come in. And more often than not, runners come in after they're injured. I would really love for runners and triathletes to come in before they're injured. There's always something you can work on, and always something to make you more optimal and less prone to injury.
Mm-hmm. Mm-hmm.
I have not figured out how to get them in here. So maybe Tenille's got some clues.
We had in the past summit, I had an incredible kinesiologist come on, and she talked about it was Kira Shumick, and she talked about leaving something on the table. So what is it that you could be leaving on the table that you want to get better at? Like, we talk about wanting to be better. We talk about wanting to be stronger. We talk about wanting to, in some cases, be faster, or some cases to stay the same speed and not lose more speed. And so, if there's a motivation there, it's like, maybe there's something easily done.
Exactly.
Rather than, like, just by tweaking something that will allow you to have an efficiency that you didn't ever have before. And now you've saved so much energy. So at the end of that 5K, the end of the 10K, end of the 21, the marathon, whatever it is that you're looking at, you have more energy. and you're able to
Exactly.
put out something. So what are you leaving on the table? Go and visit Denise a little bit before you, or way before you get injured. So we actually, maybe, you don't have to go into her injured. All right.
Exactly.
Got it.
Exactly. So, all right. So, but if you're going to make any changes in your form, I always recommend it. You only do one thing at a time. One of the easiest things, if you do videotape, you want to see if you're crossing over. A lot of people cross over the midline, and so I have people run as if they're running on either side of a traffic line. So that's often one of the easiest things to shift if that's the issue. There's just more cues on running. Okay, I think that's all I got here. Any other questions you'd like me to touch on running? I talked about a little bit about cadence. I haven't read any new studies lately, but it was always hover around 180 steps per minute. Yeah. And but there's fluctuation, so I usually say between 174 and 184. And I haven't, like I said, I haven't been up to date on the latest research if they've come up with something new, but that usually works pretty well.
Yeah. I think it's really interesting. One of the things, and I wonder what you would say to that, is bringing in variability of cadence, like understanding if we want to be able, so we all have our own cadence. It's very hard to change our cadence, and creating the change of cadence comes with identifying that we can and have variability. So it's easy on the bike to do because we do high spin sets, but we can do it in running too. And I think that's what is really beautiful that you're bringing forward, is it's like, you can do this and do it slowly, and and your body will learn how to adapt, because sometimes it's like downhill running, for example. It's a great way to learn how to increase your cadence. Now, do we want to do a ton of downhill running? No, because that could be a little bit jarring. But using your downhill and thinking, okay, can I pick up my cadence on this so I can learn a little bit or try something new? I know I was beaten in a race, and it was very like this person who, it was coming down into the finish line, and it was this massive downhill, and this girl behind me, I was in the pro category, this girl behind me, like, her cadence was phenomenal. Let me tell you, I worked on my cadence after that, because she could just spin her legs so much faster than I could.
Yeah. Well, you know what? I think what's happening with the downhill is if you have that really good ankle lean and you're really using gravity, so you're controlled falling down that run. And you actually can access your glutes a lot better that way as well. Yeah. There's a lot to learn, and utilizing terrain and understanding that you can always learn something, I think was one of your points. Exactly. And I think you said something about how everybody has their own individual cadence. I would like to say that everybody has their own individual form. Yeah. With that being said, there are some optimal form things. We want to stand tall. We want to look straight ahead. We want our knees straight ahead. You don't want overstriding, and that's where you get somebody who does a slow cadence, like under 170 steps per minute. They tend to be overstriding, and you set yourself up for braking action, so you're going to go too slow. So we're going to work on that. Yeah. On the flip side, and when I say the flip side, but for some people, let's say they have an injury like IT band injury. We know that's typically because of a glute weakness, but they may be, cadence might be too slow. So their strides, because they're reaching out their foot too far, is too far. They don't really have the flexibility in their hips to be that long. So we might want to increase their cadence quite a bit, maybe not right away, but as a training, take short, fast steps so they're not keep re-injuring themselves. Does that make some sense? Yeah, it totally makes sense. Yeah. So you're showing that there's to the very point is that we have our individual bodies and how we are structural differences that may, and understanding those, but we still have general things that we want to keep going forward on. Exactly. Yeah. Perfect. And then on the flip side, sometimes I'll get runners in and I'll get them on the treadmill and videotape, and very little, you see very little, those basic things. all look really good. What we might see is where, why they have their injury. So let's say they have a hamstring strain. I might see, like here,
Yeah.
you see the flex in the knee, somebody with a hamstring strain or an Achilles problem, whatever the leg that has the problem, this angle might be less than the other leg. So it might be so nuanced like that, which you're not going to change in your running. We need to change that off the with spot specific exercises and strengthening and get that going. Eventually moving up into maybe some sort of running drill or plyometric to start getting that rebound effect in there.
Right, right. So the symptom is there, like you can see it when you actually analyze the running, but which will give the clue on to what we actually need to do to address it. So this is another reason why getting some support and taking a look at some of the running and having the technology to do that so you can actually see what's going on. I think it's really good.
Yeah.
Wow.
I'm going to stop this here.
Brilliant. Well, you have given us so much from this whole interview. I'm just enthralled. I love it. I love what you've been able to share with us in such nuanced and new things as well, which is exciting. I have three questions for you to finish off our interview.
Can I bring up one thing before?
Yes, you most certainly can, of course.
Yeah. I think this is actually, sometimes this is almost more important than all the physical stuff.
Okay.
It's the emotional, spiritual stuff. So as we age and as we go through year after year, things change. And, I can't tell you, probably every single day with almost every single patient, I have to have this kind of talk about accepting where they are and what their bodies can and can't do, understanding your limitations, having patience for healing. I'm trying to think of an example, but I've, people, they've had surgery, let's say just knee arthroscopic, and they think they should be running 4 weeks later. The surgeon said, "No, I'll be running." That's what the patient hears. "I'll be running tomorrow." But really, as somebody I had this morning, he's like, "It was a good 6 months." It takes a while for your body to heal. I think the best line is, you can't fight Mother Nature. This is the nature of tissue healing. You could be 16, you could be 60, you could be 80. Tissues take 4 to 8 weeks to heal, period. Okay. So whether it's a bone, a soft tissue, a tendon, it just takes a while. And so you have to work within that. So it's very important to have patience. And athletes, as you know, don't have a lot of patience. But non-athletes don't have a lot of patience either. They want to get on with their life. But patience, accepting. The other thing I think that's very important as we age and we still want to continue doing the activities we want to do, it's important to be open-minded to maybe doing it differently. Not giving it up, but for example, let's say when you're 20s, you could run 6 days a week without a problem. But now in your 40s, you're finding you're getting injured a lot, you're more tired, things feel yuckier. Let's go down to a 4-day work week run, and let's get some good cross training in there. Now, the 20-year-old should have been cross training as well, but as we get older, we need to add in more pieces. We need to really do some good cross training. We might need to go to a run walk cycle, which is what I did. So I could get through, I finally was able to do a marathon because I went to a run walk. So, it's being open-minded to, if you want to continue that, what you love to do, it might have to be a little different. And that's okay.
Yeah. I think it's such an important point that you're just making, is that our body is changing. We get to change too.
Yeah, I like that. Yes, we get to change, and it's okay because you still get to do it. Yeah.
Yeah. Beautiful. All right, now I'm going to ask you my 3 questions. Okay, good. All right. What is one thing you are thankful for right now?
Well, I am most thankful for my wonderful girlfriends and my family, particularly my mother, as I've gone through some personal issues this past year. Their support and love have been really got me through that, and they've been just wonderful. And girlfriends are the best.
Amen. I love that. Yes, I think that they are just powerful forces that we
Women need
need.
girlfriends. I tell you, it's very, very helpful.
Yeah, I agree. I am so thankful for that myself. What do you know now that you wish you knew 10 years ago?
Uh, so I think I'm still struggling with this. I tend to, and I think a lot of caregivers or caretakers, health professionals are people pleasers and are very concerned about other people. And it's important to take care of ourselves and sometimes put ourselves first and take care of ourselves. Um, I did learn early on physically how to take care of myself so I could take care of other people. But I think it's, some of that emotional stuff that, taking time. So um, I wish I wasn't people pleasing so much way back when. And now, people you can't control how someone's going to respond. You do the best you can with kindness and compassion, and hopefully people will respond in a way that is okay.
Mm. Um, like, forgive me for asking, you're postmenopause, right?
Yes.
Yeah, that's called wisdom. That was so wisdom. That was so wisdom. And I'm just like, oh, I have so much to learn. This is why I love bringing my postmenopause experts on, because they have just such a groundedness. And I'm like, this is exactly what I need to hear.
Yeah,
So
there's something, I
yeah.
just turned 60 this year, so there's a lot that goes on in those last 10 years. Every decade there's
Yeah.
something. Yeah.
Yeah, yeah. So brilliant. Thank you. What is a saying or a quote that you absolutely love or that you can live by?
Um, there's a book I often recommend to people, particularly if they're going through some sort of transition, called The Alchemist. And one of the lessons I took from that book that uh, often goes through my head, and I'm not sure I'm saying it correctly, that it was written in the book, but the gist was, as we get closer to our treasure or our true path, the challenges become harder. So as things become harder, or if you feel like you're going through struggling through something, it often means that you're getting closer to what you're really supposed to be doing in your truth and who you really are in your true path. So, and then things are supposed to turn out the way they're supposed to. So that's sort of about um, living with grace and um, I was trying to think of another word, but I think it's just allowing things to unfold
Mm.
and realize things happen the way they're supposed to, and you can only control yourself and not other people or things around you necessarily.
Mm. Wow, so beautiful. What an incredible gift you have given us, and all the information and things that we can consider and think about and apply to our life, both in a physical and a mental and a spiritual way. So, Denise, this has just been thrilling for me. So thank you very much for your time and coming
Well,
on.
thank you so much.
Anything else you wanted to share before we wrap up here?
Well, I have a really strong passion for educating people on how to take care of themselves. And
Mm.
as such, my website, I have a weekly newsletter with tips that I send out. And all my old blog posts are on there with all those tips. Tenille had found, my scar tissue and the big toe.
Yeah.
All that kind of information is there listed with some videos as well. I have a YouTube channel. Will you be listing my website
Oh,
somewhere?
yes, absolutely. It's all there right underneath this video. Yeah, people
Oh,
go
okay.
check it out. Learn, listen, get
Yeah.
on the email list. And absolutely, this has been a wealth of information that you've shared with us now, and there's a lot more that you offer. So thank you for that.
And you're quite welcome, and I appreciate being on here. Like I said, I'm very passionate about educating people. I think I have one last piece I was thinking about education. When I see athletes, um, oftentimes they can hold it together with when I look at them move. I'm like, oh, you look pretty good. But then when they just walk out, walk to sit down, they look like Gumby, for example. They fall apart during just being normal or not doing anything. So it's really, really important for you to be mindful throughout your whole day as you do things and as you move. And as we go through this perimenopausal and postmenopausal, I get women who start falling a lot, and it's really important to be mindful. You know, our brains still think we can move like when we were 20, but we just don't respond that way. So I have a lot of tips on how to be mindful throughout your day so you don't fall and don't get injured.
Well, we'll make sure that it's all there for people, because I think that you have so much to offer, and I am so glad that you were willing to put the time in, because it is a gift to do. Like, you're not required to, you know, add in and support the formation of this knowledge. You're doing it because you want people to have it. So thank you very much for that. And thank you for this interview.
Thank you for having me. I really appreciate it. This was fun.